most of us, this is just a toilet. But to the poorest in the world, having one could protect their dignity, improve their livelihood, and save their lives. Sanitation is a basic human right, and everyone is entitled to have access to it. More than 673 million people are still practicing open defecation. UN's Sustainable Development Goal on water and sanitation calls for urgent action to resolve the sanitation crisis, with 2030 earmarked to achieve access to adequate and equitable sanitation and hygiene for all, and to put an end to open defecation. But in 2020, a global pandemic broke out. COVID-19 called for a global campaign on the importance of access to safely managed hygiene and sanitation facilities. The health crisis exacerbated the challenge to an already challenged sector. Facing a global crisis, one asks, what's being done to supply toilets and sanitation facilities to the underserved and underprivileged? Why is it taking so long? But as cities continue to grow, so do population densities and informal settlements. The compact living spaces in slums make it difficult to build even the most basic toilet. To top it off, households in depressed areas simply cannot afford it. So what do they use in lieu of toilets? And at what cost?
You have as a natural option open defecation or the use of poor latrines that essentially create very large negative externalities to your community.
Several families may share unsafe makeshift toilets or pit latrines that never get emptied, or none at all. This leaves a huge segment of the population, mostly children, living in polluted neighborhoods, vulnerable to diseases, deprived of dignity, and trapped in poverty. A vicious cycle they might not break out of, unless something changes. Building a toilet facility is more complex than it seems. It costs a lot, and there are enormous challenges from economics to politics that need to be hurdled. Unlocking capital for sanitation requires more work to meet stringent sets of criteria.
In order to kind of walk infrastructure projects across this path towards bankability, projects need things like scale. They need a license to invest or a capable counterparty. Those are just a few of the things that major infrastructure programs need to attract international investment. You're looking at, systems that are extremely geographically distributed. Often governance is fragmented. In sanitation and water more broadly, political risk and regime risk is more pronounced than other sectors of infrastructure. There's heightened political risk because you can have multiple regimes and there can be change over time.
And because inevitably, economy ties right into politics, investors ask, will politics affect my investment and compromise my money's worth?
Currency risk in the sanitation sector is a huge challenge. And then also ex-ante returns or underwritten returns in the sector are often limited because it's something that all but must be addressed in any investment program for international investment.
Politics and lack of funding are also the reasons why the installation of sanitation facilities never reach completion.
And a big challenge there is financing, such as well political dynamics, that lead to an outcome that is a common sight in developing cities, which is mid-construction abandonment. These are just open ditches that pose hazards to the population.
In India, affordability and lack of money to pay are the major reasons why households don't have toilets.
Not a surprise because even a low-cost or safe or improved facility requires a significant outlay.
In a case study of 81 communities in Maharashtra, sanitation loans were offered to clients in conjunction with the toilet construction subsidies from the government's Swachh Bharat mission. But this intervention proved to be challenging.
A few loans were used for toilet repairs or upgrades, which they could have done. And so we conclude that up to half the loans were not used for sanitation investments.
To some poor people, a toilet is just not worth it, and their reluctance to pay poses a big problem.
In general, we have very low valuation for environmental improvements, prices drop, and we end up in a situation where infrastructure are not very good quality, and the same type of people do not want to pay for those infrastructure.
When one takes a step back and looks at the bigger picture, we see that what aggravates the lack of funding is largely political, the lack of integrity and the abuse of power.
The magnitude of government subsidies is super large, so the subsidies are estimated currently to be around $320 billion a year, about $100 billion needed to tackle the sanitation challenge globally. Across 10 low and middle income countries, 56% of subsidies end up in the pockets of the richest 20%, but only 6% of subsidies find their way to the poorest 20%.
With a lot of stakeholders involved, the big questions are, who should bear the costs of financing sanitation? Who should play the key role in ensuring that the poor can finally have individual toilets? And the answer is everyone. Achieving toilets for all seems far off track. Radical thinking and veering away from business-as-usual approaches will help accelerate progress in formulating feasible solutions to sanitation's long-standing problems, like market failures. Correcting past mistakes requires governments to take a proactive role in managing their own resources, providing incentives where they're needed, and finding ways to cultivate environments that will enable businesses to thrive.
The public sector will have to intervene. Private sector alone would not provide the socially optimum level of the service and the quality of the service that is desired. There's already a vast amount of money that is implicitly provided to the sector, but it has to be rethought how we use that money. And one way is to, for example, provide incentives to suppliers so that they get the subsidies.
Grants and incentives as interventions to improve community toilet facilities were part of a study in 110 catchment areas in Uttar Pradesh, India.
One type of intervention is to provide directly a grant to these community toilets for improving their quality. So providing cash or grants for improvements and providing financial incentives to caretakers as the capacity, as the ability to improve the quality of this infrastructure and at the same time reducing free riding.
Having performance-based or incentive-based subsidies seems to be effective at different scales, from the level of the tiny locality up to a huge kind of urban region.
Furthermore, there's a need to create mechanisms, frameworks, and policies that support and safeguard investors, allowing them to engage in business with minimal risks.
There are, insurance mechanisms. Having that strong counterparty that's able to give a license to invest is extremely important.
You need a sort of enabling public policy environment, which creates a kind of rule book or a playbook for the private sector to engage, but at the same time realizes that its role is perhaps more enablement rather than control.
Technology is also key in the delivery of sanitation facilities and services to the unserved populations. Innovation must be harnessed as it plays a crucial role in a dynamic market. Inventions like small-scale water treatment technologies could be the solution to the lack of toilets in the slums. Business enterprises have the potential to make a great impact on sanitation outcomes. Private sector participation should be encouraged to help create a competitive market, strengthen partnerships, and adopt business models for safely managed sanitation.
I think there's a lot of room for the supply side to become more competitive, which could reduce prices and increase take-up. We increase competitiveness of suppliers through offering procurement auctions, and we see in some neighborhoods prices go down by as much as 27%. So that really enables a lot of households that otherwise wouldn't be able to get the services to take up.
The private suppliers are there, private service providers, and the markets in which they operate are also then part of the kinds of interventions that we need to structure and things we need to think about if the sanitation sector is to work and achieve the objectives we want.
An example is Sanergy, which is creating bold solutions throughout the sanitation value chain for the booming cities of Kenya.
They provide sanitation services. They have a technology to recycle the waste and actually create fertilizer, so they make an additional profit out of it.
SMEs are very quick to innovate. They're very agile. They can bring products and services to the market. And I think large companies are very good at operating at scale. Large companies, SMEs, as well as investors, sort of playing together in a field that's rightly enabled by public policy, by the government. I think that's sort of the vision for us.
A stable political climate is a magnet for investment, which translates into productivity and cascades its benefits to the poor. Addressing political issues like corruption and lack of persistence could enormously improve and accelerate the delivery of sanitation projects.
One important aspect related to subsidies in the wash sector for network systems is to think carefully in terms of ensuring that subsidies are not ending with the richest segments of the population.
There's a bit of research on local bureaucrats dynamics, incentives to complete projects to be more productive, a type of conditionalities that, for example, international organizations can impose when starting a project to finish it.
Having a toilet is more than having a fixture. It means having multiple shareholders working together to finance, deliver, sustain, and innovate sanitation for the good of all. It's also having a sense of ownership and knowing that health, well-being, lives, and futures of generations and nations depend on it, because a toilet is more than it's worth.